Extra line after double eyelid surgery. Is this normal? I just had my double eyelid surgery operation. It is now 4 weeks and I am worried about the additional line fold next to the corner of my eye towards the nose. Is this normal?
Thank you for your question. You submitted a single photo with your question. You state in your question that you underwent Asian upper eyelid surgery about 4 weeks earlier, and that you are concerned or very worried about an additional crease or fold that is pointing towards your nose, and you want to know if this is normal. Well, certainly I can share with you my perspective about your situation at this stage, as Asian eyelid surgery is a significant part of my practice, and in fact patients come to us from around the world for this type of surgery, both primary and revision surgery. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years, and as I said, Asian eyelid surgery is a practice focus for us, and I can basically give you a understanding that I suspect your surgeon also shared with you. To begin with, Asian eyelid surgery in principle is about creating a connection, and this is whether it's non-incisional or incisional. Basically, it's a connection between the skin and a muscle called the levator aponeurosis, or the levator palpebrae muscle. The point is that there are stitches that are placed to make that connection, and between the eyelid and the new crease is an area where a lot of fluid can collect. And what I see in your photo is that there is swelling, and that swelling affects the skin, as I described, from the margin to the crease as well as above the crease. What is unique to a degree to Asian eyelid surgery is that this swelling can persist for months. It goes down slowly, but it can be significant enough to affect the area and affect the appearance. So essentially, it is something that does require time. Now, based on this appearance, it looks like your doctor did what's basically a nasally tapered crease, which means that, and why I think that's important, is that if the design was such that it stopped just short of the epicanthal fold, then it's not likely that there's that much tension that would be pulling the eyelid skin parallel to the epicanthal fold. You know, there's basically two types of creases when we think about designing a crease for Asian eyelid surgery. There's a nasally tapered crease and there's a parallel crease. If this is most likely what it looks like is a nasally tapered crease, then I suspect this fold is more a result of tension as well as swelling. And as the tension and swelling diminishes and the area matures, it's likely to be less significant. It's important to understand the stages of wound healing, and although we are very proud of helping our patients get back to work as early as a week after surgery, it is still important to understand that the body goes through very specific stages of healing. And the first month is basically what's referred to as the proliferative stage. This is a stage where there's a lot of collagen being produced. There's a lot of blood supply and a lot of activity. And when there's activity around the eyelids, there is swelling. So it's understandable to be concerned, but I think that you have to allow this area to heal. And when I say heal, I'm talking about several months. So basically allow at least 3 to 6 months. I think that's, of course, very important that you speak to your doctor about this. But as we do in our practice, we see our patients fairly frequently, particularly after Asian eyelid surgery. So we might, in the first few months, see a patient like yourself every month, just to monitor the process and to see how the swelling is resolving and help give guidance about how things are going, and as well show the progress so that you get a better sense of how, even though it doesn't look like a lot of change over time, there is significant change. So I hope that was helpful. I wish you the best of luck. And thank you for your question.